Hi, my name's Dan Driscoll. I'm a fellowship-trained orthopedic surgeon with specialization in hip and knee replacement, as well as complex joint reconstruction.
Discuss the process about when to have knee or hip replacement.
The decision to have a knee replacement or hip replacement doesn't come down to any one factor. It's not about age, not about how your x-ray looks. It's really about how your knee or hip is affecting your quality of life. If your knee or hip is keeping you from doing the things you love, walking your dog, walking with your children or your grandchildren, achieving those activities that make life what you want it to be, then it's time to think about coming in and seeing a specialist. Now, we don't always start with replacement. Start with things like physical therapy, non-steroidal anti-inflammatories, or injections. But if those stop working and the knee or hip is affecting your quality of life and your mood, your sleep, your ability to do things, then it's time to think about a knee replacement or hip replacement surgery. Now, the good news is hip or knee replacement in 21st century is a very reliable and very precise surgery. We use computer navigation and robotic navigation in order to give you a new joint that you're going to like. This is very different than the surgeries we've done 50 years ago. We're happy to get patients up and going again, and we're able to do that very reliably. So if that's something you're thinking about, definitely come on in and we can discuss the options together.
How do you define a successful knee or hip replacement surgery?
That's a great question. Many surgeons have different thought process in terms of what a successful hip or knee replacement means. But for me, it comes down to one question: would you do it again? And my goal is to have every patient that I treat answer yes. We do hip or knee replacement for 3 reasons: for pain control, for range of motion, and most importantly, for quality of life, to get you back to the things you want to do. As someone who's been involved in research involving quality and outcomes, my goal is always to give you the best bang for your buck, get you the best outcome with the least amount of intervention possible. And using some of that data that we've compiled in the work I've done from an academic standpoint, we're able to do that very reliably.
When is the time to discuss knee or hip replacement or revision surgery?
Great question. So hip and knee replacement is a very reliable surgery until it isn't. And revisions or needs for a redo surgery are uncommon, but when they happen, it's important to go to somebody who you trust and who has experience in treating complex joint reconstructions. Joints generally last 20 plus years when we do them well, but there are things that can come up. So if you're having pain, dissatisfied with your hip or knee reconstruction, you have an infection, it's time to come in and talk to an expert. Again, revision surgery is not something that should be rushed into at all. Many times the answer is non-operative treatment. But when you make that decision, you want to make sure you're coming into it with clear eyes, knowing that you've got someone who you want to work with and want to go through that journey with. And so we're happy to see you if that's something you're considering.
What are factors that would lead to needing a revision surgery?
Great question. So there are two categories of revision, some that are elective and some that are not. On the elective side, I generally tell my patients, you want to wait at least a year to see how your hip or knee replacement is feeling. But if you're still unsatisfied, still having concerns, still not saying, yes, I do this surgery again, then that's a time to have the discussion. Not saying definitely that there's something to be done, but definitely worth having the discussion. Other times, there are non-elective revisions where we don't really have a choice. Things like infections or fractures or loosening of the components. Now, these are all things that we do every technique in the book in order to avoid, but when they happen, again, it's not really a choice. It's a matter of proceeding with surgery. And again, you want to make sure you're going to somebody who understands those complications and is readily available to treat them.